Welcome, everybody. Welcome to H2OMG podcast for the Water Department. And today we have a very special people here with us and to talk here about the Take Back event. I'm wondering how many of you out there know what Take Back event is or it's related to. So we're going to stick around. We're going to talk to you about that. And so we'll go around the table and introduce ourselves. This is Hilda Zuniga with the Water Department.
This is David Simmons with Code Compliance and Solid Waste.
This is Amanda Robbins with Fort Worth Safe Communities Coalition.
Awesome. So, again, I was wondering how many of you out there know what Take Back is. Well, it turns out to be an issue for all of us, not just locally, but everywhere almost. And so, Amanda, if you can let us know what Take Back is.
Sure. So twice a year, the DEA sponsors the National Prescription Drug Take Back Day. It addresses a crucial public safety issue that we have, and it's a public health issue. According to 2017 National Survey on Drug Use and Health, 6 million Americans had misused controlled prescription drugs. And that study shows that a majority of those abused prescription drugs were obtained from friends, family, and often from home medicine cabinets.
Yes.
Many times when people don't realize that they are at risk for that occurring as well. The Drug Take Back Day is actually, the site is takebackday.dea.gov. And this Take Back Day has been going on for a number of years now. It's held twice annually, once in the spring, once in the fall. In the spring, we had our event throughout the nation. We had 4,969 law enforcement agencies.
That's pretty good.
Yeah, it was pretty good. And some of these agencies have multiple sites. So there were nationally 6,258 different sites that were collecting these medications that may be for, they may be expired medications, new prescriptions that are no longer needed,
Yes.
or just excess that are in people's homes many times. So there are alternatives that we can use for being able to dispose of medications year-round, but on National Drug Take Back Day, this is really when we're able to come together with our law enforcement agencies and to be able to take those medications out of our environment and create a safer place for health and safety of all.
Exactly. And the city of Fort Worth started, locally, we began to do this program back in 2010, I want to say, November 2010. And we were very surprised to see the amount of meds that people were bringing and the stories that came along with those meds. It was just like my daughter just passed and I was left with this amount of medications. What do I do? And so, of course, the number one recommendation is not to flush or not to trash. Why shouldn't people trash those meds?
So they go into the landfill. First of all, it makes a risk of people being able to get a hold of them when you take them out of your control, you put them into the trash. So that's the first risk. And then you're also talking about putting these chemicals in the landfill. And you might think, oh, it's just one or two from my house, but we service over 300,000 homes at residences every single week. That starts adding up very quickly. We want to keep those chemicals out of our landfill and away from people's hands.
So there's options. It's just not the Take Back event on October 26th that are happening. But year-round here in Fort Worth, we also have permanent locations around the city where people can actually take those meds. So if you just happen not to be ready or just doing something else that you just can't make that on October 26th, then you can also go to meddrop.org. meddropbox.org and locate the area that is nearest you. And there's no questions asked. It's basically like a mailbox. You come in, you drop your meds, and you keep going. Again, no questions asked, nothing related to where did you get them, where did you found them, or why you're bringing any type of these meds. You just drop them off, which is very good. But then there's also other issues like why is there so much medications out there? Why do people have so many left over?
Well, part of that is prescribing. There is a long history within the last 20 years where pain became the fifth vital sign from the healthcare side. My background being a nurse, that we were taught that pain is another thing that we need to be addressing, and we need to be very diligent with ensuring that people are not experiencing pain, and that is not always seen the same in other countries. So whereas, there are many people in our country that are prescribed opioids and other medications, that we don't necessarily see that in other countries throughout the world, even industrialized countries. So it really comes to a head when we have all these individuals with multiple prescriptions that are not always seeking alternative methods for pain relief, that those are some of the more common medications that we are hearing about and seeing that are going into the landfills, per se, if they are not disposed of properly and taken back at take-back sites that are permanent, or at these other events such as the DEA Take Back Day.
So, having said all that, my common sense tells me that I can take the meds where I got them. Maybe the doctor, the pharmacy. Is that not the case? I mean, why do we have to create a whole new event to get rid of meds that I got from the doctor?
That's a great question. And that causes a lot of questions in people's mind as far as is there liability issues. Where can I take them back to? Can I take them back to a hospital when I was discharged and received that prescription? Can I take them back to the pharmacy where I received them from? Not just to the prescribing person. The DEA does have registrants and a process that they must follow to be able to take medications back. Law enforcement agencies are able to register for events such as Take Back Day. But then there are other alternatives such as hospitals and also pharmacies that are able to register to be able to have a Take Back site. I do want to clarify that for National Take Back Day, that is only for law enforcement agencies to be able to register, but they're also able to partner with many entities within the community. And there is actually on that site, takebackday.dea.gov, a partnership toolbox that has information on how you can help distribute that information to your community, being able to advertise for that event, as well as seeing how the different parts of our community come together. So we're talking with water, and we're talking with code compliance, and we're talking with the healthcare system and public health, and also our treatment providers and many other areas as far as how can we address not just getting these medications out of our communities and proper disposal, but also how can we ensure that as we move forward that these events continue to reinforce that message that we need to this for the health and safety of our entire population.
We talked about a lot about the medical side of things. Why can't I just put the medications that I'm not using anymore into a can and just throw it into the trash?
So it makes a variety of problems. Again, when you are relinquishing that control, you're putting it in a trash can. You're putting it out into the public where someone can have access to it.
I see.
That's the first problem. The second problem is that you are putting these different medications, these chemicals into the landfill or into the soil where they can be, they can degrade and get into the soils or into the river systems or the waterways, and those can create hazards for the general public.
So we have a lot of people with different abilities out there that are listening now, hopefully. And so many of them might be housebound. So if I'm a person that I'm not able to move, that I'm not able to, don't have a person that visits me on a regular basis, how do I get rid of all those meds that I'm not using anymore? And you're telling me not to put them in the trash, and people are telling me not to flush them, which obviously we know that affects our water quality. What's the best recommendation for them?
The best recommendation, you can get on these websites. You can get information to help you to find the best ways to do these. Again, it is not illegal to put it in the trash, but it is not the best practice, because the landfill, again, this is going into can go to somebody else's hands. Going to the landfill doesn't help anything. We don't want to put anything in the landfill. Meds aside, our landfill here in Fort Worth is filling up very, very quickly. So we don't want to put anything in there. There's a hierarchy that we have in the solid waste system. The first thing that you do is you recycle, or you do these certain practices, these best management practices, before you put something into the landfill. And the same goes with medications. You don't want to put them in the landfill. That's the last place they should ever end up. So use all available resources that you have at hand before you take that last step. Find these websites, go and get these resources, get this information where you can get help to be able to dispose of these properly. And especially, you don't want to flush them. That's the worst thing that you can do.
That's a no-no.
Them. Very much
don't
a no-no.
do that.
That has much more effects than just throwing them in the trash.
Yes, and talking about the water side, our way of treating water, it's the way that many companies, many utilities do it around the world, which is very conventional. However, sadly, there is not a way right now that in a way that technology can remove pharmaceuticals from the water, which is, again, it's very, very sad that we don't have that ability. And so we have to remind ourselves that the water that we are using right now is the same water that we are going to be reusing again somewhere along the line. Is going to be drinking our water that we just used. And so if we flush medications, again, someone down the line will use that water full of medications. So whether it's within minutes or hours or down the future lane, it's going to be the same water. There is no more water, no new water is being produced. So we have to take care of the water that we have right now. And so, no, don't flush those toilets. Can we have a flush sound?
And the same goes for landfills as well, because you'll find that most of our landfills are built near waterways.
Yes.
Because in the old days, that's where the cities were building up, and so they were just dumping their trash out. So these landfills wound up being some of our landfills are right on the Trinity River.
Exactly.
So it's very important, again, that we're keeping those out of those landfills and away from our river systems and waterways.
Going back to the medical side, is there anything being done to educate elderly? 'Cause I mean, not to pick on them, but they tend to be the sector of the population with more medications at home. And you tell me if I'm wrong. But from my experience of being at several Take Back events where people are bringing my meds, most of them are elderly. That end up with boxes and boxes. And by the way, this is just for individuals. The Take Back events are only for individuals, not business. So they have their own way and requirements to get rid of meds. But this is only for individuals. And so is there any way that we are reaching out to them to show them? I don't know if we're at the point where we can say, we can help you. Call us, we'll go pick up your meds. Or
I believe it's a cultural shift. So we start out with kids that are used to receiving a pill for pain or a pill to solve anything, right? Mm-hmm. And unfortunately, the population that is older now, that is where they started and where they passed it down to their kids and where their kids had passed it down to their grandkids and so forth. So whereas more medications are also being developed all the time, we have a culture here where that is okay to take a pill to try and solve a problem. And there are alternative methods, whether it is pain relief, whether it is other alternative therapies that are available. We try to encourage those through programs within our community. Our local children's hospital here also has a very in-depth program that allows many of those alternatives and teaching those to parents and the children as well. We have alternatives within our community as far as where those things are communicated. Are they being communicated to parents through the school districts? Are they being communicated with different nonprofit groups and through our public health department, through our water department and code as well, have been very active in the past. As far as older adults, it's, yes, we do say that they are very interested in making the world where they want to leave their grandchildren, right?
Yes.
And they want their home to be safe. So one of those events that comes to mind is the Empowering Seniors events, and that is here in Tarrant County as well. And that's on October 4th, Friday, October 4th at 8:30 in the morning, and it'll go through the afternoon. And that event, they are able to take back as well. They have worked with law enforcement agencies in that area to be able to schedule a take-back event so that those medications are able to be taken back there. There's also communications that will be shared from DEA and also law enforcement at the event about what are some of the health and safety things associated with getting those medications out of the area.
Okay.
We're very fortunate that meddropbox.org, which is the site that you mentioned earlier, lists not only Fort Worth, but all areas in Tarrant County that are either pharmacies, hospitals, or law enforcement agencies, their locations and their times that they have the take back for the medications, what types of things are allowed to be taken back,
Okay.
and why we're disposing of those. What are the reasons behind that? That site is actually hosted through our local children's hospital, which, when you ask the question, what are we doing with older adults? It's starting young. It's growing that culture as we move forward. We've also had a project that we've worked with UNT Health Science Center's Center of Geriatrics, and they were able to work with some of the local hospice entities as far as saying, how can we provide this training to the hospice staff so that is communicated to their caregivers, to their patients' families, because that is, as you mentioned before, one of those situations where we find a large volume of medications when someone is either older or has gone through a very chronic illness and has passed.
Yes.
How do we get rid of those medications?
You know, I was at the meeting on Tuesday, Safe Communities meeting, and a representative from Challenge Tarrant County was telling me about a very innovative, I think, program where they are now in contact with funeral homes. And so obviously it's a very sad situation when someone passes, but they are talking to funeral homes so that they can in turn educate their clients as to what to do with all those meds that are left behind. And so I thought that was very innovative and very creative, because sometimes, most of the time you don't want to talk about what was left. You just feel that pain. But sooner than later, you still have that issue where you need to get rid of those meds. And so I think providing that information right after it happens is it helps maybe in a way. But anyway, I just thought that was very, very innovative.
And it helps in a couple ways because they are providing an opportunity with these doTERRA bags to be able to.
What are those?
doTERRA bags are pouches that are created for deactivating the active substance in medications for those individuals who are not able to get them to a take-back site.
Gotcha.
Or
okay.
for certain types of substances.
Is that something I can throw in the trash?
It is.
Okay.
It
cool.
is, and it deactivates medication. There are some questions about some research moving forward as far as what would be the long-term impact on those medications, but we're still seeing the health and safety aspects of getting those medications out while they're active, deactivating them, getting them out of the homes, and not into the hands of persons that should not have them.
That's pretty interesting. So how do I get one? I mean, how are they available to individuals?
There are a couple options. So there are some funeral homes, like you'd mentioned, that this is something that is provided to the family members upon finalizing arrangements that they're able to help dispose of medications. There's also some options with coalitions such as Challenge of Tarrant County, where they are able to pass those out in large quantities as well. We also know that the National Safety Council National Safety Council is able to send bags for doTERRA.
Okay.
And there again is the opportunity to really be able to get either if it's smaller doses or if there's other type of medications that are not easily disposed of.
And are these only for like pills or does it include liquids? Is that something I can put in this pouch?
It does include liquids.
Oh, nice.
And that is one of the best parts of these
Yes.
bags because that's a challenge that is seen many times at take-back sites.
Exactly.
There are some opportunities for bringing liquids to take-back sites, but many times that can be challenging.
Yes.
And pills, capsules, powders, any of those sorts. You can also provide a liquid medication as long as it is sealed.
Okay. Yes. So if I'm taking a bunch of meds to the take back, do I have to do something to prepare the meds, the pills that I'm bringing over, or should just bring everything in a bottle or consolidate or what?
Consolidation is probably the best manner to go. As far as the bottles themselves, removing your personal information is always something that people either like to do or cross it off with a black permanent marker. And then also being able to bring those medications together where it's not, you can find many times where there may be 1 or 2 pills in 10 different bottles, and that's a huge volume. And we have better ways to manage the waste and the disposal of those bottles. I'm sure you can speak to that more so than I can. But as far as the medications, as long as they're sealed together and everything is confidential when it's brought to the site, there are no questions asked. It is, and then everything is incinerated from that point.
That was my next question. So what do we do with all that med? So they just pour it into a well, or what do they do? They pile them up and light a cigarette and just shoot it into space.
Well, that's a great question. So one of the things that they do is we keep track of how much is being collected.
Okay.
We're not looking per se to see which type of medications. That is more of a compliance issue that can be of concern if an entity that distributes is bringing back medications. And so the DEA does monitor to see how many pounds of medication are we taking back at these events, and then they incinerate the medications once they have them in high volume.
Gotcha. Okay, so
so as far as the medications and how many we've taken back in Fort Worth, we had started, as you'd mentioned, our inaugural year was really in 2010. And we started with that first Take Back event with the DEA. And Fort Worth has participated with that every year. Some years there was only one event. Most years there have been 2. So this will be the 18th one in 10 years.
Wow, 18.
18.
Jeez.
And in those 10 years, we've gone from having 0 permanent sites outside of the DEA Take Back events to now we have available 12 sites within the city of Fort Worth.
Yay, Fort Worth.
Yeah.
Yes, we're doing great with that. So I don't have it broken up as far as how many pounds per the DEA take-backs alone.
Oh, okay.
But
That's
we
okay.
combine that along with those 12 sites, with most of those sites reporting back how much they're able to collect. And to date, in 10 years, how many do you think?
A ton.
A ton. How much do you think that?
2 tons.
2 tons. 44,758 pounds.
Wow.
That we've been able to do in 10
tons.
years.
22 tons? Is that what you said?
That's a lot of weight.
That's a lot of
A lot of
meds.
elephants.
Yeah.
My
That's a lot.
gosh. And just considering the size of a pill.
Yeah.
Yes.
You know?
How small they are.
Yes. 44,000 pounds of meds. Unused meds.
Unused meds, and these are from individuals in our community. This is not waste from pharmaceutical companies, from hospital
Just
systems.
the community.
Just community
residents.
members.
Yes. And I understand too, it's for whatever reason, one side of town does and turns in a lot more meds than the other side of town. I come from the side where we don't turn them in. My mom is more like, espérate tantito. no los tires. Don't throw them away. We're going to use them next. So is that something that we should do, Amanda?
Well, that is something that we see. So there's probably several reasons that individuals will have these medications that they either do not dispose of, that they bring back to the take-back sites versus throwing in the trash or putting into the waterways.
Just the cost alone, you know?
The cost alone can be a concern.
Yes.
And one of the things that we have seen is that people are holding on to medications or providing them to other individuals that may be taking the same prescription, and that's actually an illegal process to be able to do. You cannot distribute, even if it's the same type
I won't
of
tell my
medication.
mom where my mom lives. I will not do that.
But also, we don't know when these medications are older and when they've reached their
or the
expiration
potency.
date. Correct. Some of them may be more potent. Some of them may be less as well. So we don't know what we're taking at that point or how that will impact our health.
Exactly. So that is a huge issue where people are borrowing or lending or whatever their meds, and they shouldn't be doing that. And hopefully that will go better. But right now, I think it is a big issue amongst our community. Anything else? I'm running out of questions. I don't know what else to point out.
The hot topic these days really is opioid epidemic. And we started talking about that after the start of the drug take-backs began. And really the focus...
Do you think, I have a question for you.
Yes.
So do you think that was an issue before the take-back were started, or it just began to be this big, huge monster that we have now?
Absolutely. I think that it's been a problem for years and that we didn't realize what we were doing.
Okay.
To hear some of the physicians that I hear speak now that we believed we were trained in the proper way, for example, that we believed that people needed this certain amount of medication to be able to overcome illness and surgeries and these sorts of things. But it's really... on top of the fact that we've been prescribing and asking for things more so than ever before, is that it's coming to a head where we're really seeing people's lives being taken into a dangerous way, either because people become addicted before they even realize and find alternative manners, or, there's always different points in life where people are trying to seek and try out new things, and sometimes our teenagers or our young ones or young adults can be some of those. So too often unused prescription drugs can find their way into the wrong hands, and it's dangerous, and it's often tragic. And that's why we often see that thousands of folks across the country do have the ability to clean out their cabinets and find things in there that they may not even realize. One of the things that is seen that people do not think about is that it's not just medications for humans also.
Oh, yes.
There's
That's
the medications for our pets and our loved ones, and many times those prescribing practices are just as dangerous as some of the prescription practices that we've seen for us as community members.
And those type of medications, veterinary medicines, are also accepted during the take-back events. So people can bring those if
absolutely
their puppy's doing better. You can bring that unused meds to take back.
And we encourage that highly, because again, if you're holding on to those substances, you never know who may be accidentally or intentionally trying to access those medications.
Yes. And I saw several instances where they just, for whatever reason, they had leftover medications that they were using with their pets, and they just came in and they asked. And I was like, yeah, sure. No questions asked. Whatever you have, we'll take. And so they did. And so I think a lot of people do know the risks that do come along with keeping and saving those meds at home. But then there's still others that need a little push, some information in order to make them make that trip to our site. So Anything else?
I would add one thing. Please come to the event. It's really important. It's a great thing. It's a great service to the community. And if for some reason something bad happens and you can't make it, please take advantage of those drop-off locations where you can take them, because we see in the solid waste industry a lot where we have these big biannual or annual events and people have been saving up their tires or whatever for this, and then their kid gets sick or something, they can't make it, and we wind up finding illegal dumps later on down the road. So if you've been saving up your stuff and you're ready to get it, something happens, you have all of these locations where you can still take them. Of course, we'd love to have you to see you at the event as well.
Absolutely, yes. The last thing you want to do is to flush them or to trash them, because it doesn't help anybody. It only affects everyone when you do that. So we invite everybody to come and bring their meds in whatever container you have them. If you can put them in one, that's best. Just if you want to, you can always remove your information, your personal information, and drop it off. Just as easy as going down the line of any restaurant, any fast food restaurant. Yeah.
And as a reminder, it is a national day.
That's right.
And many of us have loved ones, friends, family outside of our Fort Worth community. It's a national Take Back event, meaning that if you go to takebackday.dea.gov, that on October 26th, there will be sites listed there for all territories, all areas of the U.S. You just enter in your zip code there, and it'll show you the closest sites that are registered. There's several that are registered within our city, thankfully.
Yes.
And we also have several within Tarrant County as well. That site that you'd mentioned, as far as other take-back opportunities, or if you missed the event, which is from 10 a.m. till 2 p.m., you can go to meddropbox.org, and that will also list the locations within Tarrant County for the permanent sites.
Yes. Thank you. So there's no reason why somebody should stay at home on October 26th, right?
Right.
So we do have several organizations here represented. So I would like for everybody to just tell us where people can go to your site, whether it's social media, website, and find more information about your organization. Is that cool?
You can go to fortworthtexas.gov, code compliance, and you can find all kinds of information on there, including some of the stuff that we talked about today.
Gotcha.
For Fort Worth Safe Communities Coalition, we focus on a couple different injury prevention areas, and this one really being a focus through our drug overdose and poisoning prevention task force. Our site is www.fwscc.org, and that would list our resources under there as well.
Awesome. And for us, water department would be almost the same thing as code. So it's fortworthtexas.gov. But do follow us on social media. We have Facebook and Twitter pages, Instagram, and then this podcast, share this message. This is a very important message that affects everyone at home. Whether it's you using the medication or a person who's not using the medication anymore, or someone that has some weird ideas to abuse about this information, to misuse these medications. There's just so many ideas out there, sometimes creative ideas, sometimes not so much, that only cause issues for all of us. So please do come and visit us on October 26th from 10 a.m. to 2 p.m. at takebackday.dea.gov. And you'll find all the information there. You just need to plug in your zip code, and voila, the nearest site will come out, and we'll be waiting for you there.
Hey everyone, John Michael here. So you may have noticed me missing from this episode, or maybe you didn't. Maybe this is your first episode, or maybe you don't pay that much attention, but Hilda took my place today. You see, Hilda has a passion for the Take Back Meds program and knows way more about it than I do. So I asked her to take the reins on this interview, and she very kindly agreed. I was there running the soundboard though, and if you listen very carefully, you can hear me say something about shooting the medicine into space. Anyway, thanks to David and Amanda for somehow finding our office and coming to talk to us. This is an extremely important issue, and we'd love for you to help spread the word about this event. Again, it's on October 26th, and you can find out more info at takebackday.dea.gov or meddropbox.org. dropbox.org. Now to switch gears for a minute, we just got some really cool H2OMG t-shirts, and I did a post about them last week on our social media, asking people to like and listen to this episode to see if they won. So here goes. Our winner from Facebook is Trisha Kelly. Our winner from Instagram is Eva Duran Kellums. I think I'm saying that right. And our winner from Twitter is Cel Sanchez6, @CelSanchez6. So, if you're listening to this and you just heard your name, send an email to wpe@fortworthtexas.gov to let us know what size you need, and we'll get it to you. Thanks for listening. Tune in next month because every Wednesday we'll have a brand new episode in our Lake Worth Monster miniseries. I did some investigating, and I'm very excited to announce that I finally solved the 50-year-old mystery. Can you handle the truth? The mystery unravels on October 2nd.